this lecture, we will see various tooth numbering systems used in dentistry. So before we go to various tooth numbering systems, we must understand certain terminologies. What is dental formula? It is a formula for denomination and number of teeth for mammalians. Tooth coding, which includes dentition, either permanent or deciduous dentition, arch, either maxillary or mandibular arch, quadrant, it may be right or left, and tooth name, that is the specific tooth which we are talking about. Coming to dental formula, for incisor we will designate it as I, canine as C, premolar as P, and molar as M. So coming to the dental formula for human beings in primary dentition, I 2 by 2, C 1 by 1, M 2 by 2, which makes 10 teeth on either right or left side. Same way for permanent dentition, I 2 by 2, C 1 by 1, P 2 by 2, M 3 by 3, which makes 16 teeth on either side. Coming to various tooth numbering systems. First was Zigmondi Palmer tooth numbering system, which was invented by Adolf Zigmondi in the year 1861 and by Palmer in the year 1870. Combined, it is now known as Zigmondi Palmer tooth numbering system. It consists of symbols designating in which quadrant the tooth is and the number indicating the position of the tooth from the midline. Here on the right side, you can see the symbols used for each quadrant. Now, if you want to show whole dentition, then Zigmondi Palmer cross is used and the 1 to 8 numbers are given from midline to each specific tooth. For deciduous teeth, instead of using numbers, here alphabets in capital letters are used from A to E. Here is how we can show primary dentition in Zigmondi Palmer tooth numbering system. And for permanent teeth, we can show dentition in Zigmondi Palmer tooth numbering system like this. Now, there was disadvantage of Zigmondi Palmer tooth numbering system as it was difficult to type in computers and difficult to verbalize. So another tooth numbering systems were invented to overcome this disadvantage. Universal numbering system. It is official tooth designation system in United States. It was endorsed by American Dental Association in the year 1968. It was basically invented in the year 1882 by Julius Parrott. Now here we use numbers 1 to 32 to show whole the permanent dentition. Starting from the upper right quadrant, upper right third molar is given number 1, going in clockwise direction to the upper left quadrant, in which number 16 is given to the upper left third molar, number 17 for lower left third molar, and going clockwise, number 32 for the lower right third molar. Now for deciduous dentition, we use alphabets instead of numbers. From A to T alphabets are used. A shows upper right second deciduous molar. Going clockwise, J shows upper left second deciduous molar. K shows lower left second deciduous molar. Same way going clockwise to T, lower right second deciduous molar. This is how we can show deciduous dentition in universal numbering system. This is for permanent dentition. It has advantage of ease of computerizing the data. Now what if we want to show a supernumerary teeth in universal numbering system? For permanent dentition, we can add number 50 to the adjacent teeth in universal numbering system. If we want to say there is presence of a supernumerary teeth adjacent to the upper right third molar, we will add 50 to the number 1. It will make number 51. So this will show that the supernumerary teeth is present adjacent to the upper right third molar. For deciduous dentition, simply alphabet S is added on the right side of the original alphabet used for deciduous dentition in universal numbering system. So it is easy to remember, and for recording data in computers also it is easy. Coming to next tooth numbering system, that is FDI tooth numbering system, which stands for Federation Dentare International. It is a 2-digit system. It was originally proposed by Dr. Jochen Weil in the year 1970, and except United States, all around the world it is used. As we saw, it is 2-digit system. The first digit indicates the quadrant of the tooth, and the second digit indicates the specific tooth type from the midline. Number 1 shows the maxillary right quadrant, number 2 maxillary left quadrant, number 3 for mandibular left quadrant, and number 4 for mandibular right quadrant, and the specific tooth from the midline, as we saw in Zigmondi Palmer tooth numbering system. So this makes 2-digit system of FDI. For primary tooth, instead of using 1 to 4 for the quadrant, we will use number 5 to 8. Number 5 for maxillary right quadrant, number 6 for maxillary left quadrant, number 7 for mandibular left quadrant, and number 8 for mandibular right quadrant. And the second digit would be same as what we saw in permanent teeth. That is number 1 to 5 is given in deciduous teeth. So this was all about the 3 main tooth numbering systems that we are using today, among which FDI was the latest developed, and it was easy to understand and teach, and it is easy to pronounce and dictate, and it is also easy to record this system in computer data. Now coming to some of the not well known systems. First is Hillischer system. There is use of colons and semicolons to distinguish primary and permanent teeth. And one more thing to remember is it is designed only for deciduous teeth for mixed dentition. Now here, disadvantage includes difficulty to communicate, write and type, and it requires much concentration and patience to understand this system, and it is really confusing. So it did not become that much famous. Coming to another tooth numbering system, Mons Dubois system. Here we will use even number for the right side and odd numbers for the left side, and for the lower arch we will use horizontal line along with the number. Now here also disadvantage includes confusion regarding the use of horizontal line in the lower arch and not in the upper arch, and the use of decimals require much more concentration and time to dictate, type and write. Here is another not well known tooth numbering system, Victor Header-up system. It is almost similar to Zigmondi Palmer tooth notation system. For primary teeth, we will add 0 on the left side of the numerals, and the signs plus and minus are given to show the quadrant and the arch. Plus sign for the maxillary arch and minus sign for the mandibular arch. If plus is present on the right side, then it is showing right quadrant, and if it is on the left side, then it is showing left quadrant. It is same for the permanent dentition also. Advantage includes it is computer friendly and it is easy to understand, but disadvantage includes when we are noting dentition for mixed dentition period, then it is little bit confusing and it is difficult to dictate. Coming to another not well known tooth numbering system, that is Wolfeld system. It is basically used to show deciduous dentition. It is almost similar to the universal numbering system. Here alphabet D in capital letters is added on the right side of the number of that specific tooth. From 1 to 20 numbers are given to the deciduous teeth, and alphabet D is added on the right side. Disadvantage includes There is no anatomic reference in this system. It is difficult to learn, and again, for mixed dentition, it requires much more concentration while recording. Another tooth numbering system for deciduous teeth, Fricom and Lysol. Here, suffix M is added along with the specific tooth. Again, this was creating confusion while recording the deciduous dentition. Now coming to another tooth numbering system which was recently developed in the year 2011 by Chromatol, MECAP notation system. Here, it has become easy to note a specific tooth in this system. For permanent teeth, we will show the specific tooth by its designated code, that is I, C, P or M, and numbers are showed on either upper right, upper left, lower right or lower left of that specific code. And for deciduous teeth, we will simply add small letter D on the left side of that code. So it is easy to understand and remember, and it can be used when we want to show some specific tooth. Coming to another tooth numbering system for deciduous dentition, which was developed by Professor Dr. Raghavendra Hawale. It is known as alphanumerical dental notation system. It is almost similar to the FDI tooth numbering system along with the Zigmondi Palmer tooth numbering system. Here, the first digit will show the quadrant and second alphabet in smaller letters will show the specific tooth from the midline. As you can see, it is easy to remember as well as for record purpose in computers also it is easy. So this was all about various tooth numbering systems. To conclude, understanding and following proper tooth numbering system reduces the miscommunication in interdisciplinary dental care. It improves risk management and it gains effective communication with third-party administrators, ultimately enhancing the dental practice experience. This was all about various tooth numbering systems. Thank you.